That's beautiful. Richard McConnell, a very good friend of mine, he's actually a cancer coach who takes people from California and San Diego area down to Mexico and helps them to choose the right clinic. So he's a very, very nice fellow, very beautiful person. Now he would like to have the difference between radio wave and microwave hypothermia explained. What is better and what is the heat difference?
Okay, there are two different types of local hypothermia devices on the market. The type 1 works with radio waves, and radio waves are electromagnetic waves in the, that have a frequency from 10 to 100 megahertz. And if the frequency is higher, above 100 megahertz, the physicist calls it microwaves. So microwaves have a higher frequency and transport more energy per time unit than radio waves. If you treat tumors with radio waves, you can cause a specific overheating of tumor cells if you use a frequency that is around 13.56 megahertz. That's the frequency that Oncotherm uses in their devices. And the advantage is there is no special focusing needed. You don't have to protect the healthy tissues in order to not get the damage where you don't want to have it, because tumor cells are sensitive to this frequency. They resonate if you treat them with this frequency, whereas normal cells don't resonate. This is the fantastic invention of Professor Sass that he made 20 years ago, based on the physics of a cancer cell. A cancer cell is sensitive for this frequency and a healthy cell not. So that is why we call it self-focusing. If you radiate with radio waves, 13.56 megahertz, only the tumor cells go into resonance and get overheated, and the neighboring cell, which is healthy, does not resonate in this frequency and remains untreated. And if you use microwaves, which is an approach that BSD, an American producer and developer of hypothermia devices, uses, you get heat in over the region that is treated with these rays. You have no self-focusing, and you have to cool down the tissues that you don't want to damage. BSD has shown tremendous results and made studies at the University of München in Germany and in Berlin, and I pay respect for the results that they showed, but it's a much more complicated way of treatment and much more expensive because of the fact that you need to cool the tissues that you don't want to damage. Yeah. And this is not needed with radio waves. Radio wave treatment needs a little longer to get the result that you want to have. You need to give it at least 10 to 15 single treatment with 1 hour per treatment in order to get the result you want to get. And with microwaves, you can get faster results already after 1 or 2 treatments, but it costs a lot of more money, and it needs more staff, and it has the risk of burnings in regions where you don't want to be burned because of the lack of specificity. All the tissues, all the cells get warmed up and overheated if you use microwaves.
And as we know that any kind of burning causes scar tissue, within the scar tissue, the healing process is stopped. Wherever you have burns, the healing doesn't work properly anymore. That's what we know from 2nd and 3rd degree burnings, which then actually slows down the actual healing process. Whereas if your healthy cells all can work and only the cancer cells die, then you have a much faster process in taking off all the dead cancer cells and healing that part of the body.
Exactly. And you cannot treat regions like the brain or the lungs with microwaves so far. The microwave-based hypothermia treatment is limited to regions like urinary bladder, extremities for muscle cancer, in other words, sarcoma, and there is a study done right now for pancreatic cancer. As far as I know, other organs are not treated so far with microwave-based hypothermia devices, where the radio wave-based hypothermia, in other words, the Oncotherm treatment, is possible for all organs in your body, inclusive the brain.
Yeah. I realize that I think there is a reason why all clinics in Germany, Denmark, Sweden, Switzerland use the Oncothermia, because they are really the top notch of all standards.
Yes, we have 2 of their devices and can cover all possible organ treatments that are of relevance. So
yeah, and for those who are interested, I actually have a whole series of videos in our members area about local hypothermia, where they can see it in action. They can see how it is applied with brain tumors, how it is applied with all sorts of tumors in different locations. So you can watch it there.
Excellent.
Okay, where was the next one? Thank you for this. Can Dr. Henning explain? Where was I? No, that was here. This is great, Marcus. Can I ask if they have any remissions with throat cancer? This cancer is hard to treat with natural medicine, and it's very dangerous.
Yes. My first question is, what stage? Throat cancer is difficult to treat, and in all the years that I've been working with cancer, that's more than 15 years now, I only met 2 patients with throat cancer, and they came in a very late stage. So my experience is limited, and with 2 patients in 15 years, I cannot give you a proper answer on your question, and I need to know in what stage you are. Theoretically, the approach that we provide with local hypothermia and natural anti-cancer treatments with IV drips is possible for every stage. But what stage are you in? And I need to know a little bit more about your situation and the dimension of your cancer.
Okay. Fabulous opportunity, Marcus. I would like to know what alternative treatment is available for B-cell non-Hodgkinson lymphoma when no tumors have appeared, but the lymphocyte count has continued to rise over the past 2-year period.
Hematological diseases are difficult. There are more than 100 different lymphomas today, and that is why there are specialists only for lymphomas. That's enough information that you can learn every day if you read the articles about lymphoma treatment. Difficult question to answer with this limited amount of information. In general, what we talked about is of relevance even for this patient. But what specific treatment is needed? Sorry, I need more information, and this is an individual counseling situation, which is too complex to do in this way we do right now.
Okay, that's the second question. The next one as well from Michael. What type of treatment is best suited to my indolent marginal zone NH lymphoma?
Another lymphoma. We see results with hypothermia in combination with anti-cancer drugs. We actually saw a very impressive remission the other month with a patient who received a special remedy that is made from a mushroom, from a poisonous mushroom called Amanita phalloides. And there is a researcher, a professor in biology at the University of Magdeburg, Ulrike Riedl, who does some research with this poisonous mushroom, and we saw a tremendous remission of a patient with lymphomas on his throat in the size of tennis balls that disappeared in this single case as snowballs in the sun. He reacted very, very positively on this Amanita treatment in combination with hypothermia. So this is a single case with one special type of lymphoma. As I already mentioned, there are more than 100 different lymphomas today that we differentiate.
Yeah, but when we just covered, I think in general, it really is, when we look at hypothermia, you never do hypothermia on its own. You always combine it with any kind of anti-cancer drug. You do, and I think that's one of the questions that we're going to come to, but you do chemosensitivity testing, you do energy testing, you do really search, you use homeopathics, you use GC-MAF, you know, like there is like, when you say that so relaxed in between with the IV treatments, there is a complete setup with zinc, selenium, all of the lacks that people have, which we are deficient in because our soils are depleted, our food is depleted. So to bring all those levels up, you know, it sounds like it's just the hypothermia. It's actually that holistic approach. Yeah. I've spent too long in your clinic. I know it all.
Yeah. Well, let me say some words about chemosensitivity tests. There are some laboratories in Germany who specialize in this field of chemosensitivity tests. What is that? We collect the blood specimen and send it to the laboratory, and they want to have some 20 to 30 milliliter of whole blood in an EDTA blood vial. And then, number one, they collect the tumor cells out of this blood specimen. They have special filters and special markers that allows them to take the tumor cells out of the whole blood specimen. And then they make laboratory tests with these tumor cells. So they collect circulating tumor cells and do specific tests. They test whether these cells are treatable and how they would possibly react on a treatment that is made at the clinic. They check for genes in these tumor cells and for special enzymes that make them vulnerable for the treatment of special substances. And as now I want to quote one of Germany's top leading cancer researchers, who is a professor at the German Cancer Institute in Berlin. His name is Hans Lehrach, and he said in an interview that was published in the German newspaper Die Zeit last year that 80% of the chemotherapy treatments that are provided in general oncology in this country, and that is also the truth for all the other countries in the world, 80% don't have a chance to work because the patient has not tumor cells that are receptive, that are vulnerable for the chemotherapy. 80%. This is shocking. Imagine that 80% of cancer treatment that is done today in this city, as well as in Brisbane and in Sydney and in London, does not have any chance to do its job.
It's shocking. It's really shocking. It's shocking. When I first heard about the chemosensitivity test, it really shows how irrelevant, how you know, box thinking. That's what you have to. We take it without seeing any tests before whether it works. So
yeah. So let's give me a very simple picture of it. You open a box, and in this box there are some screws. And you don't look how the screws look. You just take some screwdriver out of your box and blindly you try to open the screw with the first screwdriver that you happen to get into your hand when you grab something in your toolbox. So why not looking at the screws first and measuring their size and taking the screwdriver that fits? So that's what these laboratories want to help us with. They look what kind of tumor cells are in the blood and what kind of chemical drugs have a chance to do the job and not only the damage.
Can I ask a question here? Because I know that a lot of people say if you take those samples out of the blood, it's actually quite vague because you might have a preliminary, a main cancer, a secondary cancer. If you would take a biopsy from the cancer and you would actually give that to the lab, it would be more accurate, correct?
That's true. The best results we get from investigating tumor tissues. So if somebody wants to do this test, the best chance to get a relevant result is to send a little sample of the tumor that was removed. And for those who do not know that yet, your pathologist or your surgeon is obliged to keep a portion of your tumor in the laboratory for 10 years. That's at least the case in Germany. So you can always ask the hospital for the tumor specimen that was taken out of your body and send that tumor specimen to the laboratory, and then they can do the tests.
So
if you don't have the tumor test,
yeah, when you have a patient, how long does it take to have that sensitivity result?
2 to 3 weeks, and that is due to the complex tests that they do. These tests take as long as 2 to 3 weeks. They treat the cancer cells with different substances in the laboratory in order to measure enzyme activities and do genetic tests, and these tests take 2 weeks.
Okay. All right. Now, I have one more question to that chemosensitivity test.
Yes.
That's a part of my body taken out and tested in a petri dish to what it works. Now, in regards to my holistic viewpoint to treatment, if I still live in a crappy relationship, if I have stress all day, if I have phobias, fears, resentment, if I have a bad diet, then no matter what that cancer tissue in the petri dish reacts to, my body might not.
Exactly.
Okay.
So it's a good tool. It's not it's not the answer of to all our problems, but I can give you some examples where it can be of any help.
Good.
For instance, you have a disease where chemotherapy still provides some beneficial effect, or at least a possibility of a beneficial effect. Let's say early stage ovarian cancer, and you want to know how is the chance that the next chemotherapy could help me to get into remission again. In this situation, and you are already decided to do standard chemotherapy. In this case, you can get enormous informations with relevant aspects for your further treatments if you do the experiment in the petri dish and not in your body. So for patients that are decided to continue with chemotherapy but want to know more, is it more cisplatin or gemcitabine, or is it carboplatin, or is it 5-FU? So there are tons of different questions you can ask the laboratory and ask them to do the test in a petri dish and not in your body. And with this test result, you can, with a higher degree of chance that the chemotherapy really helps you, say, yes, this chemotherapy was tested, my cancer cells react on it.
Unfortunately, do clinics here in Australia, and I know in Australia, in New Zealand as well, refuse to take on the results of the chemosensitivity test because they are obliged by the insurance to take exactly the drug which is prescribed for that cancer, and they would not be allowed to deviate otherwise, not even if the patient agrees to pay privately, not even then. So that might work in Germany, but certainly not in Australia.
Yeah. Well, we have limitations in our way of communicating that with standard oncologists here as well. But that is a political problem, and it leads us to the field of interaction between pharmaceutical companies, interests, money, business. I mean, imagine that they don't cover a test that limits the risk of 80% failure.
Let's go on to Bob's question. 5 years ago, I was diagnosed with stage 4 melanoma. I take 1200 milligram a day of vitamin C. Should I increase? The cancer is in the middle of the chest. Can that spread to the heart? Thanks in advance. Well, it's little information, but...
Yes. Well, 1200 milligrams of vitamin C a day is definitely something beneficial, but it is not enough to keep your melanoma under control. Definitely not. Continue with it. It does not harm you, and it enhances your soft tissues and has some immune activating effect. But you need to get more and more powerful treatments in the way of our holistic approach. And to your question, can it spread to the heart? This is very rare that it does spread to the heart. It is more likely that it spreads into other organs. So, but There's definitely a risk of that you develop more metastases, and in your case, everything I do in our clinic, we do at our clinic, is something I can recommend you in order to lower the risk of metastasis, of more metastasis.
Okay, always those difficult words. From Lynn, what would be the recommended treatment for stage 3 round cell myxoid lymphosarcoma?
Okay,
this
is
about the
sarcoma.
size of a softball.
Yeah, it's
a soft muscle.
It's a soft tissue malign tumor called sarcoma, and I need to know on what region the patient developed this sarcoma and the size of a softball. Okay. Surgical removal would be the first approach, and I guess that the tissue tumor is in a region where surgery is difficult, otherwise the patient would have received it already.
No, it says in the left calf muscle of a 35-year-old male.
Okay. Can it be removed surgically? Question mark. If not, a combination of hypothermia and anti-cancer drugs in the way we described it is my approach.
I saw a young girl in Austria, in Eagles at the clinic, that had that type of cancer, and it was here at the arm, and it was actually the size of almost, I would say, a soccer ball or volleyball, and it was affecting bone, and the normal oncology wanted to amputate the arm. Now what they did was exactly what you just prescribed, local hypothermia directly onto the tumor, and they used, I think, a low-dose chemotherapy at that stage because the parents wanted that, and combined that with an extreme detoxification, and within 3 weeks there was scar tissue. The tumor was really going away, and I saw that myself. And it was actually fascinating because the oncologist that sent the girl for amputation, when she went back to show her arm, he said he didn't ask what she did. He did not ask. And they wanted to tell him, and he said, "Don't tell me, I don't want to know." That's why I remember that story so dramatically.
Yeah, congratulations to that case. This is really amazing.
Okay, Lana, I'm not a doctor. Hi, Dr. Marcus. I'm a movie maker and researcher. I'm not a doctor. We have Dr. Henning here, and he's the one in charge. Is there any correlation found between methylated folate intake and cancer? Yes. No. Methylated, no. But folate intake without methylation can cause a folate block, which is actually to do with your DNA. You have certain DNA structure. Now, I'm not the real person to do that. Sabrina is, or Dr. Seelman, but you can take folate, which can lead to cancer if you create a folate block, and it's very dangerous. So that's why we recommend, in general, methylated folate, because that doesn't have the risk, but you need to do a DNA test to see it for yourself. See, well, now I gave the answer, Dr. Yes. Marcus.
And I have nothing to add. Thank you, Marcus.
Okay. All right. MG Christian, what can you help to block estrogen and progesterone receptive breast cancers?
Well, once again, cabbage extract containing IC3, indole 3-carbinol, or glucosinolates. You can get that at a health food store in form of capsules with broccoli and cabbage extract. There's a lot of research done that these natural compounds convert harmful, possibly harmful estrogen into less harmful molecules, and have a proven effect on the development of cancer cells with a risk limitation and a stimulating effect that stimulates apoptosis. Remember, natural cell death is called apoptosis, and we know that these cabbage extracts switch on the apoptosis possibility in cancer cells, especially in circulating cancer cells. So this is my number one recommendation for patients with breast cancer, or for everybody who does not want to get breast cancer. Eat more cabbage, and the ones who already attracted the disease of breast cancer, look for a natural supplement containing significant dosages of cabbage extract and broccoli extract.
Okay, can we talk about cabbage? They call it in Germany sauerkraut. Now,
yes,
you don't mean fermented cabbage.
No, I don't mean fermented cabbage. I mean green cabbage, Rosenkohl. What's that in English?
Brussels sprouts.
Yes, Brussels sprouts and broccoli, and you can find it in this book of Richard Belliveau, who is a professor in biology and plant pharmacology at the University of Montreal in Canada.
Essential foods to prevent cancer. Okay, foods to fight cancer.
And he has a...
Would you repeat the name of the author?
Yes, he is called Richard Belliveau. Richard Belliveau.
Okay. Yeah, got it.
And I show you the chapter on here you have cabbage, the green leaves of cabbage, and the headline is "Cancer Hates Cabbage."
Good, I like it.
So
a lot of people do too.
You can get it in capsules, and you can eat it, of course, from your grocery store. Sauerkraut is very good as well, but it does not contain these anti-cancer substances in a significant amount. It's good for your digestion. It gives you probiotic bacteria. So eat sauerkraut as we do in Germany, but to prevent breast cancer or to treat the risk of breast cancer relapse, you need to have green cabbage in broccoli, Brussels sprouts, or regular cabbage leaves.
Yeah.
And don't forget, you can get concentrated amounts of these beneficial anti-cancer substances from cabbage in capsules.
Yeah.
You find it everywhere.
And I think it's really important because cabbage can cause, if you don't have the enzymes, if your gut is a little bit impaired, it can cause quite some bloating.
That's true. So you have to combine it with some enzymes, and then you can essential oils like what's that in English? Kümmel und Fenchel. Markus, can you translate?
Cumin and fennel.
Yeah, cumin and fennel seeds. You can chew them after a meal, as one does in Asia. In India, it's custom to give cumin and fennel seeds after a meal, and the essential oils in these seeds prevent bloating.
Yeah. Thank you. That was a good tip. I forgot about that. I actually like that. That was on every table, and it really tasted nice. You just had a spoonful after your meal.
Exactly. You can make a tea out of it, and you can boil it and drink it also, or you can use it as a spice on your meals.
Okay. We had the chemosensitivity test, AMAS test. Is that the same? AMAS test?
I've never heard about it. Sorry.
Okay, but it was in the same line. From Anne, what is your view on raw food diet, and do you restrict fruits because of the fruit sugar?
Very good question. Thank you. I'm not a raw food fanatic. I like raw food as something that is a component of a healthy diet, but I don't see the point with raw food for everybody. We are different in our genetical background. There are some individuals that have a lot of enzymes and that can deal with raw food in a very, very good manner. But there are definitely individuals amongst us who cannot digest raw food in a proper way. So raw food is not the solution for everybody. In traditional Chinese medicine, raw food has a very, very little significance, and one recommends boiled food. As you might know, Asian food in Korea, in China, in Thailand is boiled food. So there are different ways to live with a healthy diet, and you have to find out what suits to your body system and to your genetic type. In this case, the smart DNA test is definitely something that could help you to find the right diet that suits your body type.
I think I
have to warn patients to believe that raw food is the solution for advanced cancer. If you suffer from advanced cancer, you have to remain stable, and you must not lose weight. So in late stage cancer, raw food can be dangerous if it causes weight loss. So you have to combine different components, cooked food and raw food, in a balanced way. And then there are people who feel splendid with raw food, and they obviously have the right genetic type to digest raw food, and then it is perfect, but it does not suit everybody.
Yeah, we found with the DNA test, and Dr. Henning just started to offer the DNA test as well, it really is a stunning process where you can see that a lot of people really need more oils, need more fat, and they actually, the high carbohydrate from all the food, from all the veggies, can actually cause insulin spikes, and through that it feeds into the cancer. So there is many things that we need to understand, and it's certainly one of the biggest things. Everybody needs to find their optimal diet based on heritage, based on DNA, based on body composure. If you take the Indian philosophy with Vata, Pitta and Kapha, you need a slightly different diet. There is only one general rule, and I think that was part 2 of the question. No sugar.
Yes,
and
thank
fruit,
you very much.
like bananas, for example, they turn into sugar instantly. So what we learned is really mainly berries and low sugar fruit with high antioxidant levels.
Yeah. The blue ones are the most beneficial ones with the anthocyanate components like resveratrol and other ones, OPCs. So blueberries are super healthy, and berries in general is something that rank very high on our recommendation list. But I would not exclude pineapples and papayas and kiwis because they are so rich in enzymes, and in this case I would say the amount of fructose, of fruit sugar in pineapple and papaya is not a danger because other aspects add so many beneficial components to your diet. So I allow, and I even recommend my patients to eat papaya, kiwi, mango, and pineapples, fresh, of course, not canned, but fresh. And sweet fruits like melon or bananas should be limited. If you eat a banana once in a while, it is not dangerous, but it should not be something that you eat every day.
Yeah, and I think the other part of that, what you just said, is that you eat a fresh, organic, non-sprayed, and full fruit. A lot of people then start juicing, and they have 25 apples in their juice that they drink, or concentrates and things like that. That's not it.
No,
so if you
that's too much sugar.
Really do that in a small variation.
Yes, exactly. And the quality is in many ways more important than quantity. If you eat food that is contaminated with pesticides, this is more important than the sugar amount of it. So go for the quality. Look for organically grown vegetables and fruits. It's worthwhile.
And now we have the last question from Dorothea, and she is from Germany, and she has one of the questions that you will love, because when I was in Germany, I have to admit I was really angry. We did the whole interview by accident in German, and then I didn't show it to my list, but we did an interview on thermography, and the question is, I was invited for mammography, but after all that I know, I did not use this diagnostic technique. I would like to go for thermography. Where in Germany can I find such a possibility? Thermography detects in an earlier stage and does not harm. I would be very happy to hear where to go and what you think about it.
Well, one place she could go is Arcadia Clinic in Kassel. Welcome. We provide thermography investigations, examinations, and I'm really thrilled by the technique and the resolution and the whole approach of doing pre-care with thermography and even aftercare. In many cases, after surgery, we take care of the other breast by regular examinations with thermothermography. And so what is thermography? It's a camera, a very, very special camera made by Carl Zeiss here in Germany that is very sensitive and can measure temperature differences as little as 0.1 degrees centigrade. So we get a picture of the warmth distribution on the body surface, and this gives us very important information about tumors. Thermography can be used for breast imaging and skin imaging and superficial tumors like skin tumors or lymph nodes that are warming up the skin. We can't look through the skin deep into the organs. That's not what the field of thermography, but breast imaging, skin, and subcutaneous tissue, that means the tissue that is directly under the skin, is what we can examine with thermography. So with a high resolution image, we get more than 100,000 temperature measurements on a picture that show us the distribution of warmth. And the fact is that tumors are warmer than normal tissue. So if somebody has a breast tumor, a cancerous tumor, it shows up as a hot spot on this thermography image with a high accuracy and a high degree of reliability that we can find cancer with thermography.
Yeah, I remember you have a very sophisticated machine. It's like very, very high tech.
Yeah, it's the best that is available on the market. It costs a fortune, but it is worthwhile because it helps saving lives. So
just the process. I remember it's like when you do that thermography, you do like the cooling process of the breast, and then you create a series of images, and you can even see slight information. You can see hormonal imbalances, all sorts of things. So it's very intense what you can read from it. And
we don't touch the patient. We don't need to touch the patient. If you imagine how painful it is sometimes to do standard radiology-based mammography where the breast is squeezed between two platelets, we don't even have to touch the patient's breast. We ask the patient to undress, and the patient rests his arms on a special armrest so that we can make pictures of the arm tip and the breast, and we make images from 3 different sizes immediately after the patient undressed. And then we ask the patient to remain in this position with armrests underneath her arms for 10 minutes in normal room temperature, 22 degrees centigrade. And after 10 minutes, the body surface cools down. But in regions where there is tumor, the cooling is less than in normal regions. So the tumor remains warmer than normal region. And then we do a second series of images, and where there is tumor, we see hot spots. We even can see vessels and make a thermography-based image of blood vessels. And if we see blood vessels that are in a chaotic or more deranged pattern, we can make hormone imbalance visible through this special pattern of blood vessels.
Yeah.
Comparable to the international grading of breast imaging in standard radiology, we have 5 different categories of findings. It's called BRAS 1 to 5, and 1 and 2 is harmless. 3 is something that we have to observe and ask the patient to come back after 3 months. 4 is high risk for cancer, and 5 is as good as always cancer as the reason for this finding. So without touching the patient, without doing any harm, only taking a very, very special image with a thermal camera, we can get a lot of relevant information that helps us to take care of the patient's health.
Beautiful. Thank you so much. What I wanted to say is before that you have a colleague, you're not alone in your clinic. You have actually very excellent staff and 2 very qualified doctors working with you. And I think as a final note before we stop, because I think we do the second part and the other questions in another interview, that we actually get through, because I guess until tomorrow we're going to have a few more, and then really to make it efficient so that we don't take all of your time. And I'm really, really grateful for your time, that you share it with us, that you help us out, and that you bring a little bit more light into this fear-based, educated field of cancer.
The specialists tell us in 20 years, every second individual will catch cancer. So we have a lot of work to do, Marcus.
Yeah, we're on it. Thanks a lot. And I'll call you tomorrow if that's okay. And then we'll just go through the rest.
Yeah, thank you very much, Marcus.
Thank you. Have a beautiful day.
Thank you. Bye-bye.